Hey, we're going to see all the causes of vomiting. Okay, so the causes of vomiting is divided into three types: acute, chronic, and recurrent. So each of these categories have two names. Two divisions: gastrointestinal division and non-gastrointestinal division. We're just going to try and play a game where we name a particular organ and say what all the diseases can cause acute vomiting because of a gastrointestinal cause, or a particular organ system which is non-gastrointestinal and causing acute vomiting, and so on and so forth. Let's get started. So the first one is acute. We'll see gastrointestinal, non-gastrointestinal. So in the stomach specifically, the acute vomiting can be because of gastroenteritis. If it is the liver, it's going to be hepatitis. If it is the pancreas, it is pancreatitis. Gallbladder can be cholecystitis. Appendix can be appendicitis. And overall, the intestine can be malrotation or volvulus or intussusception. Okay. So these are all the things which can be causing acute vomiting is case of gastrointestinal causes. Acute vomiting can also be because of non-gastrointestinal causes. For example, if it's going to be the renal tract, the UTI can also cause it. And if it's the brain, it's going to be due to meningitis or encephalitis. Sometimes infection like pertussis can also cause. Well, if it's meningitis and encephalitis, it can cause, it's a central nervous system. It can also cause raised intracranial pressure. And then with respect to the endoplasmic reticulum, the metabolism of the drugs is going to be screwed up. Like for instance, drug or toxin induced vomiting can also be there. Apart from that, certain miscellaneous stuff, like for instance, defects in the fatty acid oxidation, defect in respiratory chain can also lead to vomiting. Apart from that, diabetic ketoacidosis can also lead to vomiting. Moving on to the chronic causes of vomiting. In case of gastrointestinal, it can be again gastritis, but like from the beginning, we're going to look at the esophagus. So the first one is going to be GERD, which is gastroesophageal reflux disease. And then in the stomach, there is gastritis. And then we come downwards at the gastric outlet. There could be gastric outlet obstruction, which can again be because of a peptic ulcer, or it can be a hypertrophic pyloric stenosis. And we come downwards, there's small intestine. In the small intestine, again, it's going to be small intestinal obstruction, but it's not going to be due to volvulus or intussusception or malnutrition, malrotation. It is going to be due to stenosis or annular pancreas or superior mesenteric artery syndrome. Basically, all the so-called geeky stuff in the surgery. Okay, all these stuff. And apart from that, can be in the lower esophagus once again, can be achalasia cardia, or it can be eosinophilic esophagitis, meaning just like some sort of tropical esophagitis can also cause the same clinical feature. Apart from that, gastric paresis, which is nothing but I have no idea what gastric paresis is, but it's going to cause it. And sometimes chronic food allergy can also cause chronic vomiting. So like even if there is vomiting, the person takes the same food, keeps on taking the same food. And apart from that, we are looking at a non-gastrointestinal cause of chronic vomiting. For that, overfeeding is the most important cause because like consistently the person is feeding a lot. And then comes uremia. And then chronic sinusitis and raised intracranial tension. So we're going into the recurrent cause. Okay, I have a mnemonic for this. It's called ROSU. ROSU stands for raised intracranial tension, that is R. O is overfeeding. S is sinusitis, which is chronic sinusitis, and U is uremia. Okay, and then moving on to the recurrent causes. Why will a GI condition cause recurrent vomiting? It can be because of abdominal migraine, meaning just like the person has headache, there is abdominal pain. And it can be cyclic vomiting, so like the person has vomiting syndrome, cyclic vomiting syndrome. Or it can be malrotation, which is associated with the volvulus. So like it can cause recurrent vomiting. And the non-gastrointestinal causes could be due to diabetic ketoacidosis. Already we know diabetic ketoacidosis is going to cause acute vomiting. The same thing can happen here too. And then urea cycle defects can also cause the same thing. The last one is Addison disease. Addison disease can also cause recurrent vomiting. So you can remember DAO. DAO stands for diabetic ketoacidosis, Addison disease, and urea cycle defects. With this, thank you.